Welcome back to 12 to Health. I'm Dr. Derek De Silva. We're taking a time out this week from what's ailing us to what's ailing the healthcare system in New Jersey. From hospitals closing left and right to the growing number of uninsured and a shortage of doctors and nurses, the state of healthcare in our state has reached a critical level. Here to talk about some of these healthcare issues facing New Jersey is the CEO of Liberty Health, Joe Scott. Liberty Health operates and manages Jersey City Medical Center, Meadowlands Hospital in Secaucus, and Liberty Home Care. Joe, thank you for joining us today.
Thank you. I'm glad to be here.
So healthcare is a mess. Hospitals are closing. What's going on?
Well, I don't think it's all doom and gloom. I think there's lots of opportunity out there, but I do believe that hospitals are under intense economic pressure today. There's a significant number of hospitals who just are not getting enough reimbursement to cover the cost of care.
And is that the issue? I mean, is that really the issue, is that the funding has really stopped from the state and federal level? Or has been cut? It hasn't been stopped, it's been cut.
I think there's a couple of issues. One, you have to be able to manage patients as efficiently as possible. And I believe that there's an opportunity to manage patients better. The problem is that even with better management, I still don't think we fund hospitals at the level we need to in order to provide and provide for the cost of care. Mm-hmm. So I think there's a couple of different issues. I think hospitals overall, I just read an article about hospitals not only in New Jersey but throughout the country who have declared bankruptcy. And a lot of them cite a couple of different things. One being they didn't realize they were getting into trouble and didn't act fast enough to be able to turn things around. Mm-hmm. Two, the ability to manage patients as effectively and efficiently as possible. You know, things like end-of-life care are important issues. And we spend an extraordinary amount of money at the end of life. If we can manage that process better and put patients in the appropriate venues, I think we can reduce some of the cost associated with that.
Right. Yeah. I mean,
overall, there is an additional issue with just the sheer reimbursement being able to cover our costs. Mm-hmm. So I think when you start combining all those different things, there's a variety of things that cause hospitals to really have to close.
Well, so what do you, as the CEO of this big healthcare system, what are you doing that is different and innovative to keep yourself afloat?
Well, it's interesting because we're taking a little bit of a different approach. We're actually looking at how we can manage patients better and be as efficient as we possibly can. We've identified 4 things that we think are important as we move forward and in order for us to maintain viability. One is to improve access to care for patients by making sure that we have enough primary care providers in our community. The second is to implement a complete electronic record that ties all the providers back to the hospital so we can begin to share that information and become more efficient. The third is to identify patients who are at risk for coming to the hospital frequently because we're not managing them appropriately. Mm-hmm. And the fourth is to really empower patients to learn how to take care of themselves when they have these chronic conditions. I think looking at it from a different perspective and putting those 4 things in place, we'll be able to manage patients at a much higher level and be able to begin to see us actually reducing the cost of care until we can get to the point where everybody has insurance, right, which, as you know, is what President Obama would like to see happen.
For the people that are watching, that are going to emergency rooms, that are visiting the ERs and all the stuff that's involved in there, that are constantly there, if you will.
Sure.
What do we do for them? You know, you one of the things that you identified are the regular visitors, if you will.
Absolutely.
What are you doing to try to cut that down?
Right. Well, for example, we have 2 things that we're doing right now. We have a clinic called 115 Columbus, where patients can walk in and get appointments at 115 Columbus in Jersey City. We'd like for them to go there if they just have an acute illness and they really don't need the emergency department. Emergency department care, as you know, is very, very expensive. Right. So we'd like to see them go there.
So it's kind of a doctor's office visit type thing that you can walk into a clinic.
That's right. We also have the Federally Qualified Health Center at Metropolitan, which we work very, very closely with. They also have a whole variety of services, and they're open during the day also to be able for patients to walk in. So between those 2 sites, we'd like to see patients go there proactively when they're not feeling well, rather than come to the emergency department unless they really truly have an emergency.
One of the things that also teaching hospitals, you know, the governor's budget calls for a $12 million cut in teaching hospitals. Right. Muhlenberg recently closed. It was a teaching hospital. Right. How is that going to impact all of us?
Yeah, that's we actually have a teaching program, and we have residents that we currently train in internal medicine and OB. And so we're concerned about that. Every time additional dollars are cut out of our budget, we've got to figure out how to do more with less. That's why I think it's so important to have a comprehensive approach to really looking at how we're going to manage patients at a much higher level. Because I don't believe in this economic environment things are going to get better before they get worse. So our opportunity is to really do that. Now, that being said, we're also working with those residents and trying to have them stay in our community so that they can then provide the care and improve the access for our patients. And I think that's the key.
What are you telling patients as far as taking care of themselves? What about local initiatives? What about local screening programs?
Yeah.
Do they work?
Actually, today we're at the Newport Center in Jersey City doing a health fair, and we have all of our healthcare providers out there actually trying to screen people to get them into some preventative care programs. But we have a couple of things. We have, within our organization, we have something called COPE, which is our community outreach program, going out to all different sites, telling people about the healthcare services that are available. We have healthcare for the homeless. We have a group of people that go out and look for people who need health care, who are homeless at this point in time, and try to put them into the appropriate venue. I think when you start looking at all those different things, that's how you begin to manage some of these.
Well, speaking of homeless, what about the uninsured? I mean, that falls right into that category.
Yeah, and that's a tough environment because, you know, there's a whole host of issues associated with uninsured patients. Everything from, you know, are they here legally to, you know, will they actually sign up for charity care or for any type of governmental program at this point in time? And that's frequently a challenge. We have locations throughout all of our sites where patients can sign up for a coverage if they don't have it. So I think that's another kind of proactive thing that you need to do from a healthcare perspective.
Well, what I'm seeing, and from all the people that I've spoken with on various programs, you know, I think what it comes down to is the ability for the hospitals to do something, for the patients to proactively do something, and for the community to really get together on this whole thing.
Absolutely.
I mean, I don't see this thing resolving unless all those factors come together.
I agree. It's got to be a comprehensive approach, and it's got to be an approach where everybody's on the same page in terms of what are the outcomes we really want to achieve.
You we've got 30 seconds left. Give me your solution to the problem.
One, we identified the need for additional primary care physicians in our area. We're going to go ahead and recruit a significant number of doctors to do that and improve access. Two, we're going to implement an electronic record. In fact, I just met with my medical staff to talk about how we can integrate them to the hospital. Three, we're going to develop a disease state management program where we take the patients who frequently come into the hospital and manage them better so that they don't have to come into the hospital as frequently, reducing their cost of care. And four, we're going to work on, through our community outreach program, empowering our patients.
Well, I think primary care is really important.
Absolutely.
I have to say that.
Yeah, I would imagine you would say that.
I think primary care is one of the most important things because there are so many specialists out there.
Sure.
And I thank you very much for being here. We really appreciate your time today.
Sure.
Mr. Joe Scott, once again, if you have any questions or comments about today's interview, or if there's a topic that you would like to see discussed in our program, email your thoughts to us at 122health@news12.com.